Oh my God, if the doctors found out I smoked one cigarette, they would cancel that surgery. No ifs, buts, done. I say let's do this, Doc.
Okay.
You know, it's not just one surgery now. I'm getting the sleeve done, I'm getting breast reduction.
So this is weird. Angela is getting a combination of a gastric sleeve, which is an operation that helps you to lose weight, and a breast reduction, which is an operation that reduces the size of the breasts and lifts them up. Most doctors wouldn't necessarily recommend performing both of these at the same time.
And anything can go wrong when you're under. Your blood pressure could drop, you could stop breathing, and that's scaring me.
This is completely true. Whenever somebody asks me, Dr. Youn, what's the worst thing that can happen if you perform surgery on me? I always answer that you can die, and we go from there. And that's why I always encourage my followers to use plastic surgery as a last resort.
We're gonna do a sleeve gastrectomy today.
A sleeve gastrectomy is a weight loss operation where a large portion of the stomach is actually removed, making it much smaller. When the surgery is done, the stomach literally has about the size of a banana. Because the stomach is so much smaller, people get this sensation that they're full much more quickly and they eat less, and this therefore causes them to lose weight with time.
This morning, yes, I did. I broke down and smoked.
Smoking is about the worst thing that you can do prior to an operation. When you smoke, it constricts the blood vessels that lead to different parts of your body. So if you're having a breast reduction and you smoke, your nipples can literally turn black and they can fall off.
Oh my God, if the doctors found out I smoked one cigarette, they would cancel that surgery. No ifs, buts, done. I say let's do this, Doc.
Okay.
By not being honest with her doctors are under a false sense of security with this operation. It's not their fault that she smoked, but now if she develops a complication from it, it's their responsibility to take care of her. And that really, honestly, is just not fair to her surgeons. She needs to be honest about it. Otherwise, it really is just being kind of jerky.
Have you talked to your husband, Michael, today?
Yes.
What did you tell him?
I broke it down to him, and he wanted to ask you some questions before we started. I said we won't.
Your wife is telling me that you're not happy that she's about to have surgery.
Why should I be happy?
Maybe you should be happy because your wife is doing what she feels is best for her and her health.
Let me ask you a question. If you were to pick one part of the body, what is your favorite part of her body?
The breast, the breast.
Okay, is it me or is this just kind of getting weird and creepy?
And the goal is to remove about a pound of breast tissue from each one because it's too big.
When she told me, I'm not really happy about it, but...
Big boob, it's still going to be big. It's going to be perky, like okay. It's going to stand up.
Okay.
1 pound off each breast is about 450 grams. This is the size of a relatively large breast implant and is the minimum amount that most health insurances require for them to pay for a breast reduction. When a woman has a breast reduction surgery, we have to remove a certain amount of tissue from each breast for insurance to cover it. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Oh, so I'm going to cut here. All these things here, so good question. And then I'm going to move about a pound of breast tissue from each one. If we were just to do a lift. Small. This is small?
Yeah, for Michael.
So we just doing a lift?
If you perform a breast lift and remove tissue with it, then it's technically a breast reduction. If you perform a breast lift but don't remove any actual tissue, you just remove skin, then it's just a breast lift, not a reduction. So as he is marking her here, it looks like he's lifting her breast up, showing her what it would look like without anything removed, just lifted, and it sounds like that's what she's leaning towards.
You just told me this is small. This is just a lift.
Yeah.
This is your boob, but it's been lifted. It's going to be too big.
Too big?
I have an idea. Don't worry.
Okay, I trust you.
Yeah.
So there appears to be competing influences in this operation. It appears that Angela wants her breasts smaller and lifted. Her husband doesn't want them any smaller, and the surgeon is trying to make everybody happy. So it sounds like in this situation, more dialogue, more communication is probably a good idea, and not just jumping off to surgery quite yet.
Now we're gonna start the sleeve part of the surgery. Stapler ready? Pull the stomach up. I'm gonna fire the stapler.
The reason why I don't necessarily recommend combining a gastric sleeve with a breast reduction is if you have a gastric sleeve and you lose, let's say, 50 to 100 pounds afterwards, your breasts will most likely get smaller. Well, if you do a breast reduction at the same time as a gastric sleeve and you make the woman smaller in a certain size that she wants to be, and then she loses 50 to 100 pounds, what then is she going to look like? Are her breasts going to be way too small for her? Because of this, I typically would perform a breast reduction after she's lost her weight and her weight is stabilized. Then I can try to give her the breasts that she's always wanted and that will hopefully stay the same for a very, very long time.
For her, she still wants to maintain her big breast. So for her, we're taking about 1 pound. No more than 2 pounds.
There is a pretty big difference between taking off 1 pound and 2 pounds. That can potentially make the difference between several cup sizes depending on Angela's size overall. I should mention that the good doctor is a real board-certified plastic surgeon. I don't know him personally, but he does have all the right credentials.
112. Okay, almost 2 pounds, yeah. Let's weigh the other side. Let me see.
So 111.
Damn, I'm good.
He told her he's only going to take off about 1 pound, and now he's at almost 2 pounds. Is Angela going to get upset that her surgeon removed a bit more than he told her that he would?
Stitch 6. Oh, Michael will still enjoy these boobs. They are big enough. This is like a double D. You enjoy them.
If he's removed 2 pounds from each breast and she is still a double D cup in size, then definitely taking size off and doing a reduction makes the most sense. Just to do a lift in somebody who is that large is not a good idea.
Waking up, you're all done with your procedure. Angela, can you open your eyes? Open your eyes for me.
Angela,
Open your eyes for me.
open your eyes.
Oh my gosh, it's so suspenseful. Is she gonna live? It's so ridiculous. Television shows always show patients waking up from surgery and the patients are kind of out of it and they're all worried that something bad's going to happen. This is how patients look like at the end of anesthesia. They've got a breathing tube down their throat. The anesthesia is still in their system, so they're kind of not really focusing and all of that. They wake up fine, and it's just the way that anesthesia typically works. Well, there's a lot more to Angela's plastic surgery story, so if you'd like me to react to further episodes of 90 Day Fiancé and more of what happened to Angela, please comment below and let me know. And if you're a fan of 90 Day Fiancé, take a peek at the video right up here where I react to Larissa's plastic surgery. These are just the beginning of Larissa's plastic surgery journeys, and I react to a couple episodes starting with this one. And if you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.